Catch up. January 28th, start our meeting, Health Committee meeting today. Would you call roll, please?
Representative Lee.
Here.
Representative Lipscomb. Here. Representative Hall. Here. Representative Sorrells. Here. Representative Mooney. Here. Representative Warren. Here. Representative Marcus. Here. Representative Gray. Representative Rafferty. Here. Representative Paramore. Here. Representative Rigsby. Here. Representative Holt Jones. Representative DeBose. Here. Representative Shiree. Here. Representative Brinyard. You have a quorum.
Thank you. First bill up today, Representative Rigsby, and we do have a public hearing called on this. It's not on here, but it was called. We had it printed before it was called. So, Representative.
Thank you, Mr. Chairman. This is House Bill 146. Before I get into what this bill does, let me tell you what this bill does not do. This bill does not make ivermectin over the counter. There's been a lot of confusion about bills like this in other states, specifically in Tennessee, which is what this bill mimics, that medication is over the counter. It is not. It does exactly what this bill does. This bill is a mechanism bill. It is an access bill. What it does is it allows a physician or prescriber, in this bill it's physician, PA, or nurse practitioner, to write a standing order. And if you don't know what a standing order is, a standing order defines therapy, in this case the use of ivermectin, and it tells how that person would qualify, how that person would be evaluated, and the dose that would be given. That practitioner would then sign that off. The pharmacist would follow that standing order and dispense that medication to someone over 19 years old if that patient qualifies for the things spelled out in the standing order. So this really is an access bill. This it makes a mechanism, and I've had the question, why ivermectin? What's the big deal with ivermectin? Why would you bring this? Well, we all know this drug was politicized during the COVID outbreak. A lot of patients wanted this therapy but had no access. Either physicians did not want to write it, or pharmacies did not want to dispense it, and so patients were going to the feed shop and getting the veterinary ivermectin, taking some dose that they read about online, hoping that it would help. So what this bill, the main reason I'm bringing this bill is for safety. I do not want patients to go out to the vet's office and get ivermectin specifically designed for animals and use it on themselves. There's different binders, there's different ways those medicines are made and regulated. It is not for human use. And so I wanted a mechanism in place that allows patients who are looking for the medicine, physicians who are willing to prescribe the medicine, pharmacists that are willing to dispense the medicines, to have a mechanism in place so that they could have a safe access to this medication. I'm not here to argue whether it's good for this or good for that. That's not the intent of this bill. The intent of this bill is to make an access mechanism for patients to get this medication.
All right, we do have a public hearing, and we have 2 in support and 2 that oppose. And we will, why don't you pick and choose, and we will let you speak 3 minutes. We have a timekeeper up here, and at that 3-minute period, we will cut you off. And I don't mean to be ugly, but if I'm doing it for those opposed and those that are the fur and against, is what I'm telling you. We're going to cut off at 3 minutes, and then you pick and choose who you'd like to start with and just rotate them.
All right. Stuart Tankersley.
Good to go. Thank you for having this hearing. I'm here to help. I'm a practicing physician, co-president of Concerned Doctors here in the state with Dr. Jordan Vaughn. We have a podcast with 500,000 listens a month and across the world. And so I think we have pretty good knowledge about what all this is, what's going on. I'm here to help. Given the utter collapse of confidence in the last 5 years, 6 years in my profession. Even the JAMA wrote an article about it. In last February, there was only 23% of American adults have confidence in their doctor. That's a Pew poll. Given this collapse in confidence, we need to turn around. We need to help the citizens. We need public access. And of all things to start with, Ivermectin is the best one. We have treated dozens and dozens of elected officials in the state in the last 6 years with ivermectin. I know for a fact, talking to the other doctors in our group, I've treated over 2,000 COVID patients all the way up to 94 years of age, 0 deaths. 0 deaths with only 3 hospitalizations of 3 days or less. This was and has been an eminently treatable problem. The most important website, scientific website, looking at the agents, over 50 agents that are studied and it is updated daily, is c19study.com. Every study in the world that goes into it is evaluated and added to the meta-analysis that's updated daily. It is unbelievable how successful this is, and the propaganda and politics against it is insane because the science supports what we... Ivermectin has over 38 known mechanisms of action against the virus, the inflammation it causes, and the blood clotting that it causes. So every provider in the state and in the country should know about c19study.com, yet very few do. That's on them. Before 2020, over 4 billion people had received doses of ivermectin for a parasite. 4 billion given out. It's over the counter in the southern hemisphere and in Central America. Dr. Pierre Corey, before 2020, was one of the premier pulmonologist intensivists in the world. He wrote a best-selling book 2 years ago called The War Against Ivermectin. He's testified in the U.S. Congress and Senate multiple times. It is insane what has gone on against this wonderful, wonderful, the safest medicine I've ever known. It's safer than Tylenol, safer than ivermectin, than aspirin.
Tom.
Okay, quick question. Can I ask a question about the code that allows Dr. Harris to write a standing?
No, sir, not at this point.
Okay.
Thank you.
Nico Corley.
Good afternoon, Mr. Chairman, members of the committee. Nico Corley with the Medical Association. And I sign up as an opponent, but I'm really not an opponent. To borrow a line from Dr. Tankersley, I'm here to help, right? I have a solution that I've talked with Representative Rigsby about and proposed to him a substitute. Our issue with this legislation is not with the drug in question. Our issue with this legislation is that there is a process that was put in place in 2019, sponsored by Senator Tom Butler right here, this gentleman. And that process set up an ability for willing pharmacists, willing physicians to collaborate together. Really, he built an interstate, so to speak, for those individuals to work together toward taking care of patients. Our problem with this legislation is it attempts to build a highway around the interstate just because there may be a few bumps on the interstate that have developed. So Senator Butler's legislation is working for those that want to work through that process. Again, our issue is not with the drug, it's with the circumvention of a process that seems to work well for those that want to do that. And so my ask of you all would be to take a look at that substitute, right? Let's not build a highway when we can fill in potholes and take care of those issues. Thank you.
Thank you.
Becky Garrettson.
Good afternoon, Chairman and members. I'm Becky Garrettson. I'm the Executive Director for Eagle Forum of Alabama. And I want to thank Representative Rigsby for bringing this bill. Ivermectin is a Nobel Prize-winning medication. It's been used in humans for over 40 years. It's FDA approved for multiple indications, and it's been prescribed over 4 billion times globally. Its safety protocol is well understood by physicians and pharmacists. Now, Alabama is not new. Standing orders are not new to Alabama. Just a few years ago, this body passed the biggest standing order ever, and that was for vaccines. So anyone who wants a vaccine can go to a pharmacy, and if they fit the protocol and the safety checks, then they can get a vaccine. Same with naloxone. There are other indications. There's one other I know off the top of my head, and I'm sorry I forgot the name, but there is a mechanism in place. Standing orders is good. What we like about this bill is we support the screening and education requirements that are in this bill. So standing orders, they include a risk assessment protocol, patient information and indications, all these indications, document guidelines. The process is in place. What Mr. Corley was talking about is much tighter. what he's talking, there's so much more bureaucracy involved that it slows down the easy, accessible method that we're trying to get with this bill. I am, our organization talks a lot with a big doctors group, and they just found out about the hearing at the last minute and weren't able to change their their patient schedules. They did want to weigh in on this, and so they've sent me statements, and I'll be happy to share those with you. But they wanted to convey their support for the concept behind this bill because standing orders are familiar, it's an appropriate medical tool, and that ivermectin's long history with low cost, known safety profile make it well suited for this type of access with these proper safeguards. So I hope that you will support this bill. Thank you.
Thank you.
Matt Hart.
Hey, good afternoon, Mr. Chairman and members of the committee. My name is Matt Hart. I'm an attorney with the Board of Medical Examiners. As Mr. Corley just said to you earlier, our concerns with this bill is not the subject or the medicine that is at issue here. It is a process. As Mr. Corley alluded to, Senator Butler introduced a legislation that created a collaborative practices between pharmacists and physicians back in 2019. We've worked with the Board of Pharmacy since that time to implement that process. It includes different things, standing orders, test to treat, expanding access through community pharmacies. And there is an opportunity for growth there that we acknowledge. And we view that this legislation, this standing order would be a perfect opportunity to continue to expand that. These collaborative practices contain important safeguards and provisions that we think are very important to patients and care, and they include things such as opportunities for follow-up, adverse events, records, things of that nature that still need to be accompany any type of medical treatment. And again, this would be a perfect opportunity to expand these collaborative practices and develop further ways for pharmacists to provide care and access in their communities in a safe and prescribed manner. As I said, from a legal standpoint, we don't believe that this legislation is necessary because the process that Senator Butler developed already allows for it. All that it takes is a physician and pharmacist to ask to have this as part of their collaboration agreement. We have not received any request of that nature so far for ivermectin. There have been for other drugs, antibiotics, and things of that nature that are already implemented across the state. Alternatively, if you felt that legislation was necessary and you want to proceed to solidify access to ivermectin or any other drug in particular, we would ask that you consider an amendment to this legislation that would place this within these standing orders within the collaborative practice, solidify that process, and create an opportunity for us to work with Representative Rigsby and the Board of Pharmacy to help streamline that, to expand that access out into the communities. Thank you.
Representative, do you have any additional comments to make? I think there may be a question or two that's would like to be asked.
Sure, no problem. Now, let me just say, in 2023, I bought a piece of legislation that would allow pharmacists to prescribe immunizations, and there was pushback on that legislation. The agreement to not pass that legislation was to have Dr. Scott Harris sign a statewide standing order for vaccines, which is what this is. It's a standing order. So I just throw that out there for clarification.
Representative Hall?
I don't know. Just help me understand. So you're mainly, I'm looking for what has triggered us to be at this point as it relates to this. I mean, what
So
is
lack of
happening?
access for patients. So patients had been prescribed or seeking to get prescribed this medication for various different reasons, and there's more studies going with this medication even now. And so patients have had issues either A, finding a prescriber willing to write it, or B, a mechanism of pharmacy that's willing to dispense it. Back during COVID, and I'll just use COVID as an example, there were many instances, even in this state, where pharmacists were told not to dispense ivermectin for this diagnosis. And so there's been issues with patients getting access to this medicine. So as
So stop
Mr. Corley said, and I want to say thank you to him, because he's been great to have great conversation with, and we just don't agree, and that's okay. But I do want to give him props for reaching out and attempting to work with me on this. I just see the highway, which is a great analogy. I see the highway as a better access to get this medication to patients today.
And so I get my question. I was just trying to see. So you're saying there are people, lots of people out there that want us to do this.
Well, lots
I'm
would be
here.
relative,
Well,
right?
You did,
So,
I mean, you didn't
so
give
there
me a
would
number,
be
so-
some patients. There are patients now. Tennessee has this law in place, and there's very much confusion about this law because everybody thinks it's over the counter in Tennessee. There is one state, and I think it's Arkansas, that did pass this law, and we actually have a piece of legislation that may get introduced to make it OTC. That's not what this does. You cannot dispense this medication OTC because it is a legend drug, which means it has to have a prescription. So even if we passed a piece of legislation that says it's OTC in Alabama, you couldn't dispense it.
But you can get the medication if it's prescribed.
In most places, potentially yes now. Now, the cost of it has gone through the roof after COVID, but yes, it is potentially available at pharmacies now, and a 3 milligram tablet.
Okay.
So you're done. So today, a doctor can prescribe it, and they can get it as is today.
Correct. That is still a mechanism in place. A physician can write it, can dispense it, just like any other drug.
So not being a physician, and certainly not a pharmacist, what is the difference in the ivermectin that they're prescribing and the ivermectin that I go down to the feed store and get?
The binders that are in the inactive ingredients are going to be your biggest, right? So inactive ingredients used in human medicines may be like cellulose or lactose or things like that. The binder in an animal or horse medicine may be completely different. May actually, if you have a side effect, believe it or not, could be the inactive ingredient more so even than the active ingredient because of the vet source, the animal source.
Representative Shirey.
So I have a few comments here. Typically, standing orders are reserved for things with strong evidence of benefit, a narrow risk profile, and clear eligibility criteria like vaccines. Also, ivermectin is not risk-free. It depends on body weight, liver disease, neurological conditions, concurrent medications, and pregnancy. I understand there's a questionnaire or something that you guys would go through. Isn't that best done by the physician?
When the vaccine standing order, it's done by a pharmacist now.
And that's a one-time thing.
Well,
On this, the standing order, you can come back and get your
It's
ivermectin whenever you
13
want.
different vaccines that's done potentially yearly.
More comments.
Actually, maybe more than that.
There's an increased risk of off-label and non-evidence-based use. We saw that right after COVID with a lot of calls to poison control because of the just bad use of it. Like I say, that's a documented misuse of the ivermectin. Whether it's the binders from the horse dewormer, personally, I think it's better for a physician to prescribe this. If my patient wanted this, we'd have a conversation. We would decide if it was appropriate or not. And if I did prescribe it, then I would follow up with my patient to make sure I'm not causing harm. I think that's typical of anything like that. We don't typically do standing orders for antivirals, antiparasitics, or this drug. There's a risk. There's a risk with doing that because of mechanisms of resistance. We keep using this, and we happen to have a parasitic outbreak, which that's what we treat with this. And I'm not so sure that we have any LOA here in the state of Alabama, but anyway, it makes it a lot harder to track adverse reactions, monitor outcomes, and make sure that they receive proper follow-up care. I just think it should be prescribed. It should be between you and your doctor. If you don't trust your doctor, you should get another doctor.
Thank you, Dr. Shirey.
Representative Rafferty. I'll get Rafferty. I'll get to you.
Thank you, Mr. Chair. Representative, I understand that ivermectin has some very legitimate FDA-approved uses for parasitic infections. River blindness, scabies, head lice, these are all things there. But the standing order framework here isn't limited to those indications. So my concern is that this is fundamentally different than standing orders for vaccines or naloxone, for instance, where the indication and the public health rationale is pretty clear. My big concern right now is that ivermectin resistance is now a serious problem for parasite control in livestock, and there is concern about resistance development and spread in nematode parasites of humans. And this isn't speculative. This is ivermectin-resistant parasites swiftly appeared in treated animals, and it's also paralyzed, salmon or fish farms, for instance. So, we've even seen in the PNAS, that is publication, National Academy of Sciences, so don't, found that statistically faster rates of skin repopulation were observed in 3 Ghanaian villages treated 12 to 17 times with ivermectin for river blindness, suggesting that the drug's effectiveness may be diminishing in heavily treated populations. So if we're putting out more of this drug into the environment, and I understand that we're talking about parasites, which are eukaryotic and mutate and develop drug resistance much slower rate than, say, bacteria and antibiotics. So I know it's not the same. But do you have any concerns about about losing an effective treatment for these very real blights that we have to deal with, including here in 2017 in Lowndes County, where we had an outbreak of hookworm? So, can you kind of tell me where you are kind of on the resistance?
Well, I don't.
And putting it more into the environment and kind of what can happen there.
Well, there's 2 things. One, I would say that would be up to the physician who makes the protocol, right? They could put limitations on how often a patient could be dispensed that medication. So they could say you could have this filled every 3 months, right? Or every 6 months or once a year. It would be up to that physician. As far as increased resistance, I can't say, because I can't say how often a patient may go take this medication. I know there are some patients who take a small microdose monthly because they're doing it as a preventative for whatever reasons. I know there's some studies out there that they're looking at higher doses for short-term treatment of other diseases. So is that going to increase resistance? I don't know. I don't know the answer to that question, because I can't say based off of this how often a patient would use that medication.
Right. I guess my concern would be is that since the amount of indications for when this would be prescribed isn't kind of more limited.
Yeah, it'd be up to the standing order.
That we could have some real issues with resistance, just as we've seen with bacteria and staph infection and MRSA.
Right.
So I think that's something that we probably need to discuss a little further, and the committee really needs to consider deeply.
Sure.
So,
Thanks for the comment.
Thank you.
Representative Warren.
Thank you, Mr. Chairman. I learned a lot. Today I've learned a lot. I'm not a pharmacist. I'm not a doctor. I'm a patient of Dr. Vaughn with long COVID. I've been suffering from long COVID 1.5 years now. And one of the things that I have seen, I've taken 25 pills a day. But when I go to Dr. Vaughn, the first thing they're going to do is take my blood. I think they're vampires, okay? And they're going to analyze my blood cells to see where I am and what's happening in my body. And this is what I think I hate giving them my blood, but I have to give them. And what I'm hearing from you is that you're saying that this medication can be administered without knowing what you're dealing with in your body. Mm-hmm. That's scary to me. Yeah. Because I've been on my deathbed with COVID. Mm-hmm. And Dr. Vaughn, Dr. Taylor, tell them I said, hey, today. It has just been amazing, the test and how they analyze what's actually happening in my body. Yeah. So I'm going to have to say, if my doctor don't give it to me, I ain't taking it.
Sure. Understood.
So I think that's where we are now. There's more to it than what you're explaining. Because when your life is online and you got these folks analyzing the way they analyze your blood to see what's wrong with you, I'd rather stick with them.
Understood.
Thank you.
Thank you.
Representative Lipscomb.
Representative, can you help me understand if a standing order were to be placed for this product, and bear in mind I have no issues whatsoever with ivermectin, but if you were to do a standing order, how long would that standing order typically be for?
Normally they're a year under the collaborative practice agreement that we have in practice now, it's 2 years. Has to be renewed every 2 years. But that would be defined in the standing order.
What
right?
happens if somebody's medical condition were to change midstream? Maybe they're not mindful of it, and then they could have an adverse reaction due to the fact that they didn't have some, well, as was stated previously, maybe some medical tests to confirm that.
Well, it's recommended as one of the requirements is you do have to encourage the patient to do a physician follow-up, right? So if that doctor put into there that you can dispense this one time, and then they must follow up with me as a prescriber, that'd be part of the standing order that the pharmacist would then have to say, we'll dispense it under this protocol, and you have to follow up with this doctor who signed this standing order, and you need to go see them.
But
So that would be defined in that standing order.
But if the doctor did not define that and left it open-ended for, say, 2 years,
Correct.
it kind of inherently becomes an over-the-counter medicine at that point.
Well, it becomes easier access to medicine. It's not over the counter. I don't want to use that term because it's not over the counter. It still requires that
practically
prescription.
and functionally, it kind of becomes an over-the-counter medicine.
Well, again, it depends on the standing order. So I understand your concern about that's kind of a wide open, loose definition. Maybe we tighten that up. We put something in there that they can't be more than a year, can't be more than 6 months. I mean, we can discuss that, talk about that. But yeah, all that would have to be defined in the standing order.
That's something you would be willing to get together with all the respective parties on?
Yeah, if that's a concern.
Okay, thank you.
All right, any other questions, comments? Representative, you have any other comments?
No, sir. I appreciate all the conversation. Thank you.
I'm sorry, Representative Mooney? Yes, sir.
Assumed it was on. I'm not an attorney, so I saw some language in here that made me want to ask a question. It's not a positive or a negative question. It's just to understand. It's looking at the process of what we have here. It indicates that what you were describing about the prescribing process and so forth. Then currently, do healthcare providers and pharmacists participating in a program receiving a benefit that would induce them to encourage patients and the public to use ivermectin? Are there other drugs that are handled that way? I'm guessing there might be.
No, essentially that's just an anti-steering clause. That's
Well, I mean,
just saying that you can't go into agreement. You're going to send me patients, and
So
I'm
that's
sending you a
currently in the
kickback.
law, isn't it?
Well, I would think that's part of, is it Stark law or something like that you can't do kickbacks?
Oh, I would
What
agree
is-
with
is
that
that the
completely.
Stark
That's
law?
why I'm asking if this is not in the current law, then we need to be looking at it broader
No,
than
I
it
think
is. But
I think anti-kickback laws are already in place.
that's what I
So
wondered why it was here.
physician, pharmacist, nobody can enter into agreement where I benefit you for benefiting me.
Great.
Yeah.
I mean, I certainly would agree with that. Then this, and of course this is coming from the synopsis, so it's not in the bill, but I just got that far and into the first page. This bill would also prohibit healthcare providers qualified to give a standing order and pharmacists who follow a standing order from being subject to disciplinary action from the respective governing licensing board as a result of dispensing ivermectin. Is that not currently?
Not for pharmacists. We passed.
So
last
this would be a
year-
change for pharmacists. Okay.
That would
That's
be
what
in
I was
addition to
wondering.
Pharmacists, and there is a piece of legislation that may be coming that just addresses that off-label.
Well, I had thought that was in place for healthcare providers, physicians,
Just physicians.
and PAs, that
Yeah.
type thing. But
Or just
this
prescribers.
would add pharmacists to that.
Correct. Pharmacists would be covered under that.
Those were just questions. Thank you.
Yeah, correct.
All right, Representative, any other comments?
No, sir. Thank you. I appreciate the comments, appreciate the time, appreciate the participation from everyone.
Okay, thank you.
Thank
That
you.
concludes the public hearing. All right, next bill on the calendar, Representative Allbright. We welcome you to Health Committee. You've seen quite a bit for your first Health Committee, so.
It was very interesting. Thank you,
Yep.
Mr. Chairman. Thank you, members. Good afternoon, and thank you for allowing me to be here today. HB 289 proposes to remove the date of disposition as a required field on a death certificate in Alabama. And it does that just because those dates of dispositions adds delays to people that are needing services and or benefits from their employer. Due to limited crematory capacities and rising rates of cremations across the state, disposition dates are delayed. Additionally, the date of disposition is not required on a U.S. health death certificate, and it is not included in reporting or recording a death on the federal level. So with that, I'm happy to take any questions.
Yes, sir.
Will you explain date of disposition? Is that day they died?
Yes. Well, no. There's the date that they die, and then disposition is either when they are buried and or cremated.
Okay, so the death date is still on there. I'm thinking of people with Social Security, you know, they die on the 29th, and you understand what I'm saying?
Yes, sir. If
Okay.
you'll look on,
That's still in there, the date of death.
yes, sir. Yes, sir.
No
The
issue.
only thing that they're taking out is the date of disposition. Page 2, line 30 is the only thing that's being changed.
All right, very good. You have a motion? Oh, a question? Okay, motion or question for Representative Soros? Oh, a motion by Representative Soros, second by Representative Gray. All those in favor by saying aye. Those against, nay. Congratulations on your first bill out of committee. Good job.
Thank you, sir.
Okay. Representative Givan, are you here? Oh, you're around the corner. Okay. Patiently waiting, and you were quiet.
Always. You all know me. Thank you, Mr. Chairman,
Yes, ma'am.
to this august body. I have before you, or you have before you, House Bill 290, and if enacted, it would become a state law, the Nursing Mothers Act here in the state of Alabama. And with this being said, the bill would be known as the Nursing Mothers Act. And it would allow for employers that they shall provide an employee with a reasonable unpaid break time, or shall permit an employee to use paid break time or meal time each day for the purpose of expressing. And of course, that is when a mother has had a baby, of course, and is still breastfeeding the baby, and would make reasonable accommodations for the nursing mother to do so. And I do know, Mr. Chairman, there is an amendment that you will be bringing, and I think someone else. And with
Yeah,
that,
we have three total.
okay,
agreed
yes, sir.
upon.
I've been working with the County Commission Association on the bill and several others, and I think you should have each amendment before you. And in doing so, at this time, Mr. Chairman, I will entertain any questions, or if I need to give further
I'll
clarification.
tell you what, let's do the amendments, and we will see what they do, and if there are any questions, we'll move them forward from there.
You want to read you want to read the document number at the top for each amendment?
Okay, I'll read these. The first document, which is EJTVSC 9-1. I have the correct one? Okay. Amendment 1. And it starts, replace line 19 on page 1 with the following. Related to employment to require certain employers to replace lines 26 through 27 on page 1 with the following. Employer means an individual or entity that employs more than 50 employees. The term includes all departments and agencies. Replace line 29 on page 2 with the following. Political subdivisions that have more than 50 employees. Okay, we have a motion and a second. Oh, yeah, you have a question, Representative Rafter? Yes.
I'm sorry, because I'm just now seeing these amendments. I mean, I guess I have a little bit of a concern with making it with redefining the employer to more than 50 employees. I mean, we're talking about a medical necessity that has to happen. So, in order to express breast milk, in order for that nursing mother to be able to get back to work.
Right.
So, or is this just an example of compromise, and this is what we came to the table with?
Well, actually, yes, sir. And this is a federal law. The 50 as standing today is federal. And the thought is an office with 3 to 5, certainly they're going to let them do, but not to necessarily spend a ton of money to build an extra room or whatever the case is.
Okay.
On a small business, that's the purpose for that.
I understand then. Okay.
And more along the lines with more smaller mom and pops.
Yeah.
Gotcha.
Yep.
Okay.
Motion for approval by Representative Gray, second. Okay.
I know there's a reason for this, There's already a federal law. Why do we need a state law?
We need to make a few modifications. There are many federal laws. We pass bills every day that are already bills that are enacted into Congress, but we can also make modifications for the purpose that would fit or best fit our state. Plus, also, there are a lot of people who really don't know that this is a federal law. And there are many employers across the state who, for some reason, are ignoring the fact that nursing mothers need to nurse, and because they fall more in line with state law versus federal law. Yes, it will somewhat mirror. We're making a modification. We're making a modification to bring it back in line with the 1 year, and you'll hear further with the amendments.
Okay, all right, we have a first and second. All those in favor of the amendment by saying aye.
Aye.
Those against, nay. Amendment 1 passes. Move to amendment RBWWRYY-1. Do y'all have that one? Okay, replace line 33 on page 2 with the following. Milk for a period of up to 1 year after the birth of the child. Move for approval, Representative Hall. Second, Representative Warren. All those in favor by saying aye. Those against, nay. Amendment 2 passes. All right. The last one, I won't read the number because it should be the only one you have left. Replace lines 42 through 43 on page 2 with the following. Provide a room or other location other than a bathroom reasonably accessible to the work area where employee may. And the reasoning behind that is wanted to have a little bit more than just a bathroom, maybe at least you can actually turn a closet and have a chair sitting in there, anything that's comfortable and private, most important.
Exactly, because that's been the toss-up has been, well, does a mother have to just go into that restroom area? Some women feel that it's unsanitary to have to do that, so it could be a smaller closet, but some type of reasonable accommodation.
We have a motion by Representative Gray, second by Representative Hall. All those in favor by saying aye. Those against, nay. That amendment passes. Now we're back on the bill as amended. A motion for Representative Warren. Representative Bose.
Yes, now that we've gotten through these amendments, what is the difference between this state law that we're looking at and the federal law?
Initially, it was the making sure that we have our time period, whether it be 1 year versus 2 years. Also, again, people tend to, a lot of times when we make the modifications to state law, it is because typically our citizens, just like with any other state, may not be as attuned to what those state laws are. And so this here, we would tailor it again specifically with regards to a location.
So federal law is 2 years.
It's 1 year.
And now we match federal law.
The initial bill had 2 years in it.
Yeah. So we really exactly match federal law.
Well, with the exception of a location.
Okay. So where we said reasonably accessible location rather than
bathroom,
close proximity.
Yes. There's a difference.
Okay. So we provide a location other than a bathroom where the federal law allows a bathroom to be acceptable.
It could be accessible. I didn't think anyone would care really, but there
I don't care. I'm just curious as the difference.
That's the difference.
Since we're going through the trouble of making a law here, the difference is they allow a bathroom to be okay, whereas we're saying that we may need another
space.
Okay.
And that was also recommendations from several members that they felt that we needed to specify that it did not just have to be in a bathroom.
Okay.
Someone made a motion, but I don't know who made the first motion. Representative Warren, okay. Representative Hall seconds that. Approval as amended. So for approval as amended, all those in favor by saying aye. Let me hear that again. All those in favor by saying aye. Aye. Those against, bill passes as amended.
Thank you.
All right, we have one other by Representative Ingram, which is HB 31, and that bill will be carried over. So that concludes our Health Committee meeting today. Sorry for the inconvenience. We had a visitor today that everyone wanted to see, so thank you for working with us. Thank you.